Hi, everyone. Welcome to another amazing episode of Let's Talk Mental Health. We're on episode 16 today, and we have with us a Liberian based social worker who is also a prospective clinical social worker and a mental health advocate. She is the CEO of Proverbs 31 Designs, and she'll be teaching us today about a very familiar topic that a lot of people believe that they have, but they don't really know whether they have it or not. She'll be teaching us about depression. Let us please welcome Miss Noleysa P Smart.
Feeling sad is totally normal, but if that sadness goes beyond weeks, it could be more than just a bad day. Hi, I'm Noleysa P Smart. Today, let's talk about depression, what it is, how it makes you feel, and what you can do. Depression is a mental health condition that affects how you think, feel, and act. What is sadness is a deep, ongoing sense of emptiness, discouragement, or just lack of interest in things that you previously enjoyed. Depression can happen to anyone at any age, in any given time. It doesn't mean that you're broken or there's something wrong with you. Common signs and symptoms of depression would include, constant emptiness or sadness, feeling down, loss of interest in things that you used to enjoy before for a long period of time, sleeping too much or too little, fatigue even after resting, and it's literally affecting the day-to-day function, changing weight and appetite, and the list goes on. You can't always prevent depression, but you can protect your mental health, and that is what I would like to focus on for this discussion. Number one, always have your health and hygiene in check. Regularly sleep, and don't let anything at all stress or pressure you. Always surround yourself with a good source of support system. That could be your family, your friends, or just people that mean well for you. Limit alcohol or drug use because these could significantly affect your thinking. More on a support system, I would recommend a family member or a therapist. Usually people think therapists or mental health practitioners are niche and just want to know your business. But rather than that, these are people who are willing to hear you out, because sometimes people just want someone who can listen to what you're going through from a non-judgmental lens and is willing to just listen with empathy to what they're going through. Going through my graduate studies, I would say that my major support system was my twin. Because just coming home and being bombarded with all of the write-ups and all of the presentations that we had to do, that was kind of stressful. Whenever I go out there, meet the world and meet the different energies from work and school, and I come home to my twin, just the slightest comment, don't forget to love yourself today, will beat this. You're special and that I'm waiting for you when you come back home. That was like a push for me. So somebody that you can pick up your phone to call, even if it's 2 o'clock in the morning, and you can cry on that person. Another thing that works for me was journaling, because there are times when people care about you, but they're just not willing to listen at that moment. A pen and a book would not judge you. Think of it as a dome where you can just pour out all your energy, all your emotions in, and at the end of the day, rip that sheet, wrap it, and throw it away. You should try, baby. If you're already struggling, you are totally okay. You are not alone. There are other people in the world experiencing exactly what you're experiencing now. Treatment options include therapy, talking to a licensed counselor or psychologist. In extreme cases, I would recommend medication like antidepressants. These should only be prescribed by a licensed doctor. Do not, I repeat, do not go over the counter and get yourself a medication that wasn't prescribed for you only because you think that you're having depression has stages, and yours could just be something minor that could be worked on as compared to being totally hooked or relying on antidepressant. A major cheap source of treatment is just self-care. Do all for yourself every day. My biggest information to myself is you're loved, you're cared for, and you are important. Because whether you like it or not, people will talk. But what stands out for you is the fact that you are your own person. You know who you are, and you're not interested in all of the negative energy that will roam around in the atmosphere. Depression is treatable, and healing doesn't mean that it's going to disappear overnight. It means that you're learning how to manage it, and you're also learning how to love yourself through every step of it. If this sounds like you or someone you know, please do not stay silent. Talk about it, because you matter. You are not a burden. You are very important, and you deserve all the love that you can get. This is my affirmation for a young person out there battling depression or just a sense of sadness and emptiness. I am not my sadness. I'm still worthy even on days when I can't smile. I don't have to have it all figured out. I just need to keep breathing, believing, trying, and keep hoping that better is possible for me. Don't forget to love yourself today.
And that is about it for today's video. I hope you enjoyed it because I did. I learned a lot. Remember, an informed mind leads to a changed behavior. I am Merville M. Smooth, a clinical social worker. Until our next episode, adios.